So tonight on my Instagram Live, I thought I'd just talk about hormones and health because hormones cause so much confusion, and I spent quite a lot of time on the tour when I was doing my theatre tour talking about just how hormones work in the body. So hormones are just chemical messengers. So what they are little chemicals that actually, they are chemicals really. They are substances that are made in different organs and tissues in our body, and they go into our bloodstream and then they affect every single cell in our body. They have really important biological effects in our bodies. Now we have hundreds of hormones, and you will have heard of hormones such as insulin or thyroxine, and I'm sure you'll have heard of estrogen and testosterone and progesterone. Now, these three hormones are all the ones that I'm going to talk about, and they're the ones that are relevant when we think about perimenopause, menopause, but also PMS, premenstrual syndrome, and PMDD, premenstrual dysphoric disorder, and even postnatal depression. So these hormones are made in our ovaries, but they're also made in other tissues and organs like our adrenal glands. Even our muscles make hormones, our heart makes estrogen, and our brain makes all three of those hormones. When we think about estrogen, we have to think about different types of estrogen though. So we have estradiol, we have estrone, and estriol. Now the most important hormone, or the most important type of estrogen we have, is estradiol. Now estradiol is a very anti-inflammatory beneficial type of estrogen that our ovaries produce, and obviously with time our ovaries don't work so well as we get older, and that's what happens really in the menopause, is that our ovaries stop working or don't work as well, so the amount of hormones that are produced by the ovaries decline. But it's not just our ovaries, it's other organs in our body as well. And what we don't know, or we don't understand because no one's done the research, is that is it all about our ovaries, or is it because there's a decline of these hormone levels in other tissues, especially our brain? I'm very interested in neurophysiology, so the way our brain works and functions. And I've done lots of studying about the way our brain functions over many decades, but I haven't been thinking about the role of estradiol, progesterone, testosterone in our brains until the last few years, when I've read more and more about how important they are in our bodies. So when we're thinking about these three hormones, they are produced in these different organs and tissues. They go into our bloodstream and affect every single cell the way that they work. So these hormones are very beneficial. They help lots of cell processes in our body. They help the way our bodies function to help reduce diseases as well, and also inflammation. So a lot of you might have heard of inflammatory conditions and inflammation that can be detrimental for our future health. And inflammation is the way that our body repairs itself or doesn't repair it as well. And so we have cells in our body that fight infection but also keep our tissues and our organs healthy. So at a cellular level, we have lots of inflammatory cells, and one of them is called the macrophage, and that is a very important cell. It produces chemicals called cytokines, which actually kill the bugs, the germs, the viruses, bacteria, and so forth, but they also help repair tissue. So if you cut or hurt your hand, for example, you might have a scar, you might have some swelling, and then with time your body repairs itself. So initially the swelling, the redness, the soreness is due to inflammation, and you have lots of these white cells, including macrophages, go to that area of soreness and damage and repair the tissue. And that's what's going on in our cells and bodies all the time. We have this constant repair going on. But if we don't have good repair, that can lead to damage to the tissues and organs and an increased risk of diseases. So it's a very simplistic way of thinking about inflammation. Now, every single cell has receptors on it for estradiol, progesterone, testosterone. And so that's how these hormones, if you like, a bit onto the surface of the cells, and a whole chemical reaction occurs within the cells to keep our bodies healthy. So those 3 hormones have very beneficial effects, especially on our macrophages, to keep them really healthy, to help have the right number of macrophages, to help the way they work and function and produce the right type of cytokines to really reduce inflammation in our body. And within every cell, we also have something called mitochondria, which are the powerhouse of our cells. They produce the energy that our cells and bodies need for all the chemical reactions that are going on all the time to keep us healthy. And on the surface of our cells, we have receptors for estrogen, progesterone, testosterone. So on the cells, but also on the mitochondria as well. And so when we don't have those hormones, our mitochondria don't work as well. We can't produce the same amount of energy for the cells that is needed. And that's when the tissues and the organs can sometimes not work as well, when our mitochondria aren't working as well. And we know the diseases of mitochondrial dysfunction, so when the mitochondria aren't working as well, are the same as inflammatory diseases. And these are conditions such as heart disease, osteoporosis, diabetes, dementia, clinical depression, Parkinson's disease, different types of cancer. And all those diseases are actually more common when we're menopausal without hormones. It's no coincidence, it's because those hormones work so well to reduce inflammation, to keep our body really fit and well. And it's important that we know this, because when we're thinking about taking hormones, we're just replacing what's missing. If we don't know what it is that we're missing or how it works in our body, it can be very easy to ignore it. And that's what's happened for so long, is that HRT, hormone replacement therapy, has always been thought of as a sort of optional extra, something that just people take if they're feeling really bad, or a lot of people think it's just a middle-class white woman's medicine and we take it because we just want to feel a bit better. But actually, if you think about how the hormones work in our body and think about how our bodies don't work quite as well often when we don't have those hormones, then a lot more people then think in a different way about hormone replacement therapy. And when we give hormone replacement therapy, all we're doing is giving the hormones of the right dose, the right type, the right the right combination to the right person. So we often start hormones when people are perimenopausal, when their hormone levels start to fluctuate and change, and then with time their own hormones decline more, and often the dose of HRT needs changing. Now we usually give the estrogen, progesterone, testosterone separately, because then we can tailor the dose of each one according to each person. And we have what we refer to as body identical, natural hormones. So when you look sort of down the microscope almost, if you look at their structure, they're exactly the same as the hormones that we produce when we're younger. They haven't been chemically altered in any way, whereas older types of HRT and contraception have all been chemically altered. They've been modified so they're not the same structure. So then you're not replacing like for like when you have a synthetic type of HRT or contraception. They still will help, but they're not going to have the same beneficial effects. And so when we give women hormones, we give them for 2 main reasons. The first one is to improve symptoms, and I've talked a lot in the past about symptoms of perimenopause and menopause, and symptoms and how they can improve with taking hormones. But the other reason why people often take HRT is to think about our future health, to reduce the risk of diseases, because we know the longer we are without hormones, the greater the risk of all those inflammatory diseases. And that's important because the commonest cause of death worldwide in women is heart disease, cardiovascular disease, and dementia. And these diseases are more common during menopause when we don't have hormones. And we need to wake up to this, because women are living longer. So they're living a lot longer than they ever used to without their hormones. And for many women, the last decade or so of their lives is in poor health, usually because of these inflammatory conditions, which can be associated with not having hormones. So it's important to understand how hormones work in our body. And then that takes me on to thinking about Well, how do women who take HRT improve their future health, and which diseases help? Well, we've known for many years actually that women who take HRT have a lower risk of all these inflammatory conditions. And it was as long ago as 1941, so nearly 100 years ago, a doctor called Professor Albright realised that women who took HRT had stronger bones, they had a lower risk of osteoporosis. And that was well reported, and it was one of the reasons why women were prescribed HRT, not just to feel better, but to strengthen their bones. But then other drugs came on in the market to treat osteoporosis, and people seem to forget about the role of hormones in their bones. And then in the 60s and 70s, people started to understand about other diseases that could be reduced in women taking HRT. So heart disease, cardiovascular disease, also type 2 diabetes, dementia, inflammatory diseases, autoimmune diseases as well could reduce with people taking HRT. And there was a big conference that I read the conference notes for. It was all minuted and put in a lovely book in 1972. So many years ago. I was only 2 years old when the conference went on. And it was with lots of doctors talking about the anti-aging effects of hormones, about how they reduce risk of really important diseases, how it's so important that we think about menopause more than just something affecting periods. They didn't know very much about the biological effects of hormones, but they saw the effect on women. But people didn't really think about it much because people were too busy thinking about menopause and hot flushes, menopause and periods. And there wasn't much training, and there still isn't, when we think about training for cardiologists who look after women with heart disease, or neurologists, doctors who look after people who've had dementia, or rheumatologists, doctors who look after people with osteoporosis. And medicine's become very fragmented and siloed. So often people aren't taking a step back and thinking about the whole person and the effect of progesterone, estradiol and testosterone throughout the whole body. Most people still think of them as sex hormones, but they're not about sex, and they're not even about gender, because men have estradiol and progesterone and women have testosterone. We just have differing amounts, that's all. So we need to be thinking of them as biologically active hormones that work throughout our whole body when we have them, and the effect that they have on our body in a very beneficial way. And this is why we have this increased risk of diseases when we don't have them. There's always been some confusion about risk of heart disease, risk of clot, even risk of dementia when studies have looked at women taking HRT. And one of the things that's really important for you to know is that it depends on the type of HRT. So the studies that have shown there's an increased risk of heart disease with HRT were using the synthetic, the chemically altered type of hormones. And they will not have the same effect. So when they did this WHI, the Women's Health Initiative study that came out in 2002, they actually used a different type of estrogen. It wasn't the natural estradiol that we give now through the skin as a patch or gel. It was conjugated equine estrogens, which basically is pregnant horses' urine. Pregnant horses' urine, about 5% contains estradiol, but 95% contains different hormones, not even all estrogens. There are lots of different hormones in pregnant horses, and we don't know the metabolic effects that they have because they didn't study them. It went to market very, very quickly. So people didn't have to analyse and do the big studies that they would now if they were taking a drug to market. So the estrogen was very different, but also the big difference with the WHI study type of HRT was the progesterone. They used a synthetic, so chemically altered progesterone called medroxyprogesterone acetate. Now that's been chemically altered so it doesn't have the same biological effects as the natural progesterone. We know that it has a small risk of clot. We know that it has a small risk of heart disease. It might have a small risk of breast cancer, but it's not the type of progesterone we usually prescribe. We usually prescribe the natural progesterone, and that can be given, as my cat, that can be given either as an oral capsule or as a pessary, vaginally or rectally. It doesn't really get very well absorbed through the skin, so we don't usually use that. But those hormones are really, really important, and it's important to know the difference between the natural hormones and the synthetic ones, because when you're looking at the studies, looking at benefits of taking hormones, we have to be looking at the studies that only involve the natural body identical hormones. And actually there aren't loads of those studies, because since the WHI they reduced the amount of research that's been done into women with the natural hormones. But actually women who have hormones in their body, i.e. women who have periods, are usually a lot healthier than women who don't have hormones. And you could say, oh, well, isn't it just because people are getting older? Well, no, actually, because we've got some really good data, especially from someone called Professor Walter Rocker in America at the Mayo Institute, who shows that women who've had an earlier menopause, so women who've had their ovaries removed at a young age, under the age of 40, have this accelerated inflammation in their body. They have a far greater risk of all those diseases I mentioned, more than women who are just ageing with ovaries that are working naturally. So we know these hormones do have an effect. And of course we've got an increased risk of all diseases as we get older, but anything that's going to compound that is important that we know, and that's where hormones do have a role. Now, quite a few of you have asked about bladder and how bladder function can be it's very sweet, isn't she? How bladder function can be affected with menopause. And so a lot of people, and I've done some Instagram lives about this already, but a lot of people have urinary tract infections, incontinence, cystitis, going to the toilet at night time more, even having some incontinence during the day as well. And that's often related to the lack of hormones in our bladder, in our pelvic floor as well. So we have hormone receptors throughout our bladder, our urethra, the tube that we wee out of, our pelvic floor as well, also obviously our vulva, vagina, around our clitoris as well. And that's important because if we think about not having those hormones, thinking about the way that the hormones reduce inflammation, it's no surprise that there's an increased risk of having infections, so kidney infections, bladder infections, urinary tract infections. I see a lot of people who have painful bladder syndrome, interstitial cystitis, recurrent urinary tract infections, and that can often be related to their low hormones. Not just their low estradiol though, testosterone has a really important effect in all those areas and tissues in the perineum and the bladder and so forth. And so a lot of times people do improve with HRT that contains estrogen, and we often give vaginal hormones as well. But vaginal estrogen might or might not help, but increasingly I've prescribed prasterone, which converts to testosterone and estrogen in the vagina and the surrounding tissues. Somebody asked today about lichen sclerosis, and a lot of women I've seen have really improved with Intrarosa and often systemic hormones with testosterone as well. And I'm really sure, but I don't know because the studies haven't been done, that lichen sclerosis is associated with a testosterone deficiency more than an estradiol deficiency. So if you have got lichen sclerosis, it's worth talking to someone who can consider you for the daily pessary of Intrarosa plus or minus testosterone systemically as well, because I've had some really transformational results. Thinking about cardiovascular disease, a few people have asked about blood pressure control. Now, estradiol works throughout our cardiovascular system, and I've done a whole Instagram live talking about cardiovascular disease and the way that estradiol protects the cardiovascular system. But it works to reduce inflammation on the lining of the blood vessels, the endothelium. It can increase the way nitric oxide works, and so it can dilate the blood vessels, make them larger and more relaxed. If they're larger and more relaxed, then blood pressure often lowers. And so estradiol in the form of natural HRT can lower blood pressure. It also affects our renin-angiotensin system, which is the way that our kidneys regulate our blood pressure. So if we have a better regulation of that system, then we can have lower blood pressure, the way that our kidneys work, which is really important actually. And so we often find that people's blood pressure reduces when they're on natural hormones. Very different to the synthetic hormones and contraception, which can actually increase blood pressure. So if someone's got raised blood pressure, they can still safely use the natural hormones. And a lot of people find that they don't, if they're on blood pressure treatment, they might be able to reduce it with time when they take natural hormones. Some people have asked about cholesterol as well. Now with cholesterol, there's good and bad types of cholesterol. And many of you might know that our hormones, estradiol, progesterone, testosterone, are actually made from cholesterol. We have enzymes that break down cholesterol. They break them down to progesterone, which then gets broken down to testosterone. Testosterone gets aromatase to estradiol. And progesterone also forms corticosteroid and cortisol, our so-called stress hormones. So no coincidence that many of us feel stressed when we don't have the right amount of hormones. But that aside, we need cholesterol. It's a very good, it's something that's very good and beneficial in our body. But there are different types. So we know that we've got HDL, which is our so-called good cholesterol. LDL is our so-called bad cholesterol, but we still need some of it as well, of course. Now, quite a few people we see in our clinic come and they have raised cholesterol, but they're otherwise really fit and well. Nothing's changed in their lifestyle, yet they've been told they need to take a statin, and some of them don't particularly want to take a statin for various reasons. But once they start taking hormones, their LDL cholesterol reduces and their HDL cholesterol often increases. And that's because those hormones have a very positive, beneficial effect on the way that our liver works, and our liver produces cholesterol. But also our brain. I've already said these hormones work in our brain, and our liver work very closely together, looking at the way that our liver works, the way it processes cholesterol as well, and the way that everything is metabolized in our body. And so actually having those hormones back can take a little while, but often with time the cholesterol will reduce. And I know as a menopausal woman myself, I would prefer to take natural hormones than I would to take a statin. And for a lot of women who don't have heart disease, there isn't actually good quality evidence that taking a statin to reduce the risk of a heart attack, if you've not had one, is actually that beneficial. The studies show that women are more likely to reduce their risk of a heart attack if they haven't had one before, so this is called primary prevention, if they take HRT compared to taking a statin. Some people obviously need to take both, and that's fine if that's what they've been advised. But unless there's a real reason to rush to a statin, then often it might be worth seeing how your cholesterol reduces with natural hormones. And it might be a combination of HRT and testosterone. All three hormones have an effect on the bone, so we know that estradiol, progesterone, testosterone can actually increase bone density, increase strength of bones as well. And that's why it's really important to have the right dose and type of hormones. So in the clinic, we often do blood tests looking at estradiol levels, looking at testosterone levels. We don't do progesterone because it's not a very accurate reflection in the blood of what's going on in the tissues. But if someone's not absorbing their estrogen very well, then we do often increase the dose or change the type of estrogen. We might change from a patch to a gel or vice versa if they're not absorbing very well, because you want to optimise hormones, not just to reduce symptoms but for future health. There haven't been great studies looking at what is the best level for each person, but we know that some levels, so above about 250 picomoles per litre, are best to have maximum bone protection. So even if someone doesn't have symptoms but their estradiol level is very low, we might suggest changing preparation or increasing the dose for their optimal future health. But because we don't know what is best level for each person, and the level's only a guide, then we often just use the estradiol levels and testosterone levels just as a marker to try and help us. But it is looking at symptoms as well, but also looking at, what other physical symptoms people might have. So it's looking at whether they're having palpitations, whether they're having dry skin, whether they're having any urinary symptoms related to vaginal dryness, for example. And some people find that they're absolutely fine on one dose of hormones, and then they find their symptoms start to come back. And that might be just because they're getting older and they're getting less hormones produced from their tissues, or it might be that they're absorbing differently. And we do see sometimes, even when people are using the same manufacturer of estrogen, either the pump or patch, sometimes a different batch number can really affect the way or the amount that's absorbed. Sometimes the pump doesn't produce the same amount, or sometimes the patches don't stick on very well. So it might not be automatically that the dose needs changing, it might just be that the preparation needs changing, or sometimes like having another prescription can help. Sometimes there are just batches where people say the patches aren't sticking on, and then they get another prescription and it's fine. So it really does vary. Just before I end, a couple of people have been asking about duration of taking HRT. How long do I take it for? And the guidelines are clear that women should be reviewed every year, and if the benefits outweigh the risk, they can continue taking HRT. And for many of us, we're taking HRT, like I say, to improve our future health. Symptoms may or may not be there with time, but it's what's happening with our future health. So as soon as we stop taking HRT, we have this increased inflammation in our body. I've already said our hormones work to reduce inflammation. So if I stop taking my HRT, I may or may not have symptoms, but I have this increased risk of osteoporosis, this increased bone turnover. I have increased risk of cardiovascular disease and dementia and type 2 diabetes and maybe mental health issues such as clinical depression, bipolar, schizophrenia. Doesn't mean I'm going to get those conditions, but I'll have an increased risk. I'm actually personally very worried about my bones. I really don't want to have osteoporosis. And of course I do weight-bearing exercises, and of course I take vitamin D, and of course I have a good amount of calcium in my diet. But actually without those hormones I will get bone loss, because it's so common. 1 in 2 women over the age of 50 who don't take hormones will develop osteoporosis. So anything that's going to keep my bones strong is important to me as an individual. And it's a personal choice about taking hormones, of course. But if you are going to take it for health benefits, then you should really think about taking it forever. We know there is some studies that the first 18 months after stopping HRT, women have a higher than background risk of heart disease and stroke. And that's probably because of this increased inflammation that occurs. So we need to be thinking more about what are the risks of not having hormones, what are the risks to our future health. And I find that it's really quite sad and very tragic actually that women are being denied hormones that could improve their future health because of this misunderstanding of actually what basic hormones are. Once we understand more and share this knowledge about how hormones work in our body as natural substances that reduce inflammation, reduce risk of diseases, then for many women it's easier to make a choice about whether they want to take hormones or not. So I hope that's helped. There's lots of information I realise that I've given you, but it just maybe plant a seed to thinking more about hormones in our body when we're younger and how they work. So a lot of information. Hope it's been useful. I'll post this on my grid and let me know in the chat whether it's been useful or not, and other topics that you want for future Instagram lives as well. So thanks for joining on a Saturday, and enjoy the rest of your weekend. So thank you very much.